Hey everybody, good evening. If you pop on, please let me know if you can hear me. Say, hey, what's up? So we're going to talk about swelling and edema, what it is, how we can get rid of it, when it's lymphedema, when it's edema, all that kind of stuff. If you don't know, I'm Heather Flexer. I am a doctor of physical therapy. I'm a certified wound specialist. I actually just got back from my very first National Lymphedema Network conference out in Boston. And I got to tell you, I was a little fish out of water because if you don't know, I'm a wound specialist, not a lymphedema specialist. And I was surrounded by lymphedema specialists, which is fantastic. It's always great to get around people and learn. But to be honest, I probably know maybe a little bit more about lymphedema than some folks, but I know it's a chronic disease. It's often associated with cancer and cancer treatments. I know you're going to need compression garments, and there's manual techniques, and I know how to do some of them, but not all of them. So, this was a little different for me, but I wanted to share a little bit about what I learned. So, with a wound, let's say you have a wound and you go for surgery, actually anybody can be at risk for developing lymphedema, but lymphedema and edema are not all the same things. Edema, hopefully it's something that's going to resolve. It would be normal for you to have some form of edema with a trauma or a surgery, like a fracture and you need to have it replaced. A joint replacement, even liposuction can cause quite a bit of edema. So it's normal for you to have edema with a surgical procedure or trauma or something like that. And what is edema? Edema is basically a collection of fluid in the interstitial space. So that means that in between the cells, there's room. And if there is edema, basically water or protein-rich fluid or some serosanguinous, some kind of fluid has seeped into those spaces and is taking up space. So what does that mean? It means that you are probably, if this is you, you're going to probably be experiencing pain, maybe some tingling sensation, maybe just a feeling of heaviness in that area where you've had a procedure. So those are signs to look out for that would be normal in wound healing during the inflammatory phase. So we have a few phases of wound healing. Homeostasis, where you stop bleeding, which happens pretty quickly. Then we go into our inflammatory phase, and that's where cells and your white blood cells and everything is pooling into that area to prevent infection, make sure that the body takes care of any invaders. So it's normal to have some inflammation and edema or swelling during the inflammatory stage. And that's going to be within 0 to 7 days. So of your injury or surgery or whatever, that's when you would have a bit of edema. So that would be normal. Now edema can range. It can be pitting or non-pitting. And pitting means like if I were to push on it, that I would leave like an indentation where my finger was. And there are varying degrees of pitting edema. That usually means that it's still fluctuant and fluid and it's moving, like we could move it out of the area. If it becomes non-pitting, it means it's a little bit more stagnant. The fluid is thicker. That's going to be more of a like you've had the issue for longer. So that might be something that you would see with lymphedema where it's thicker and heavier, and the fluid is just kind of stuck. So it's going to take a lot more work to get moving in the body than a soft, spongy fluid edema. So let's see. Yep, we talked about that. So if you jump on, let me know if you can hear me. And also, if you have any questions about swelling or edema, let me know. So let's see. So what do we do if we are noticing we've had surgery, we have a wound, whatever is going on, and we notice like that area is a little bit more swollen? There is so much that you can do. You need to watch your intake of foods. You should be looking out for sodium, kind of knock it all out. And that doesn't just mean like the salt shaker, the stuff you're putting on your food, but it also means like how much you're cooking with. And are you eating mostly processed foods? If you are, now is a good time to use the excuse to cut that out. A weird halo on my head. So definitely with the sodium, you want to watch out. You want to be intaking as much water as possible, as long as you don't have any like kidney disease or heart disease or anything like that. That should help that get better. You also want to be making sure that we are stimulating our lymphatic system, and your lymphatic system is basically the filtration system in the body, and it's an open-ended system, and it needs movement to be stimulated. It needs, so moving is really great. A huge portion of it is in our abdomen, so making sure that we're doing some diaphragmatic breathing, meaning we're kind of filling in that belly section. So we take a breath and fill in that belly section and squeeze it in all the way. Breathe in, breathe out. All of that stimulates the lymphatic system, which helps increase all the antibodies and things floating through our body, get some of that swelling out of there, get things moving again, get you ready and active and mobile again. So make sure we get moving. So let's see. So when we talk about lymphedema, there are two different types of lymphedema. There's primary lymphedema, and that is something that is congenital. You're born with it, but it doesn't mean that it occurs or you see symptoms of it when you are a baby or an infant. You might not ever even show up until adulthood, and it might be something like a trauma, an accident, a surgery, something overly stressful, taxing on the body, taxing to the system, and then it becomes apparent that your filtration system isn't working very well. So primary lymphedema can show up later. And then there's like secondary lymphedema, and that is probably what a lot of people think about in terms of cancer-related treatments affecting the lymph system. That's what I think a lot of people think of lymphedema when they're talking about breast cancer and then removal of nodes or testing of nodes or radiation of nodes, and that leads to lymphedema a lot of times in the arm, but it really can be anywhere. So other things that can cause lymphedema are infections, chronic venous insufficiency. So if you're having poor blood flow in the legs, and obesity. So if you're larger and you have very little blood flow, you're not as mobile, you're probably not eating the best foods for your system either, that can eventually affect your lymph system as well, leading to lymphedema. And of course, trauma. So if there's any trauma to the area where like an area is crushed, that there's going to be issues with swelling, potentially leading to lymphedema. So what do we do? So if you have had surgery or you're working with someone that has had surgery, we want to catch issues with swelling as early as possible. So listening to patients, listening to your body, you will likely feel the differences in your system before you maybe could even feel the swelling. So keep in mind, looking for feelings of like, it feels heavier, it feels tight, it feels tingly, and it not really going away. Those can be early signs of lymphedema. Making sure you let your surgeon know whenever that happens, let your therapist know whenever that happens. Your current therapist may or may not be comfortable doing lymphedema type treatments, but they can hopefully help you find a certified lymphedema therapist in your area. If not, if there's no one in your area, I know quite a few that are doing like telehealth and stuff like that. So please feel free to reach out. And we had one doctor during the conference that's discussed, like there's always this, well, is it edema? Is it chronic edema? Is it lymphedema? And he basically said that all chronic edema should be considered lymphedema. And what does chronic mean? It means it's been present for longer than 30 days and isn't making any improvements. So if you're having issues and you feel like this is ringing a bell for you, then this may be a good time to talk to your doctor, talk to your surgeon, talk to your current therapist, and see if you could get a referral to a lymphedema clinic, even just to get an assessment and find out if it's you or not you. That would be fantastic. So what do we want to do with edema after a procedure? We want to act fast if possible. Ice or heat really doesn't matter. You know, I know for like total knee replacements in our area, we'll talk about putting ice and elevating and all that stuff. The ice is great, but it really doesn't penetrate deep enough to create any like real change. So it's more of a sensation thing. It can help with pain, but it's not really like shrinking all the cells up. So it's more of a sensation thing. So that's just up to you if you like it. That's not really causing any harm. But if you're having edema, you probably don't want to put heat on it because that could exacerbate the issue. So don't put heat on it. If anything, ice or nothing. Elevation is always good. So if you're having, you know, swelling in your hand and your hand is always down, it's not going to be great. Whenever you can, try to rest it up on a pillow, rest it up above the heart is good because it's just going to help drain down. Moving is always better, so keep those fingers moving, keep those toes wiggling. When I work with people in the hospital after surgery, it's something I tell them to do all the time. Keep those little toes wiggling, keep them up, because we don't want, you know, you to develop little sausage piggies. So moving is always better. Again, your lymph system is an open system and it needs movement in order to pull the fluid out of the interstitial space and back up to be processed. So that is another reason why compression is used quite a bit, because it will help instead of letting the tissue kind of be lax, it kind of holds it all together and helps get things pumping. So compression is something that may be needed. That does not mean those post-op TED hose that you're wearing, those white socks. That's not real compression. Those are to prevent DVTs. So that is not compression. We're talking about real compression. And if you need assistance with that, you can reach out. I can hook you up with someone or talk to your current therapist about it. Definitely consider a low sodium diet if you're having issues with swelling or edema. There were some registered dietitians and a physician that spoke about diets for lymphedema. Of course, anything that we can do that's anti-inflammatory is fantastic. So some of the more anti-inflammatory agents are your simple carbohydrates. So cutting out the white stuff, the breads, the rices, the sugars, the pastas, all that needs to go, especially if you're struggling with edema. One talked about the benefits of the keto diet on lymphedema and also use of the MCT oil. And I picked up a book. I haven't had a chance to like totally read through the whole thing, but I picked up a book, The Complete Lymphedema Management Nutrition Guide, which looks fantastic. It's got a lot of resources. It's got, you know, exercise and MLD and recipes and everything. So I can post a link to this book below. But if you have any questions, please feel free to reach out. I learned quite a lot. I'd love to learn some more and keep going. But one thing for sure, your diet plays a huge role. Your mobility plays a huge role. And you are the only one living in your body, so you need to communicate how you're feeling and what you're able to do, and be able to get resources to help. So if you need any help, please feel free to reach out. I'll do my best to hook you up with someone. My name's Heather Flexer. This is Better Wounds. Thanks so much for joining. Talk to you later. Bye.